Hi, this is Dr. Eric Westman with another edition of Ask Adapt. Today's topic is hair loss. I do a lot of reassuring of people about hair loss in a medical weight loss program using a ketogenic diet. It's important to realize that every hair is replaced over a period of 3 to 5 years. So there's going to be some hair loss, but certainly people can notice more hair loss after any stressful event, and weight loss is a stressful event. So we diagnose telogen effluvium quite frequently. That's, for those of you who want to look it up, it's Telogen, telogen, effluvium, Effluvium, telogen effluvium, stress-induced hair loss. I can diagnose that by knowing that the hair loss doesn't have any scarring. That's an important thing. That it happened 3 or 4 months after the weight loss somewhere. So there was a stressful event, and the weight loss is a stressful event. And then it starts regrowing, and the hair starts filling in by about 12 months. So the problem in reassuring people is, yes, it's new hairs coming in. They're even healthier than before. It's just that it takes time for the new hairs to come in. Thinking about this, if you haven't been in a medical weight loss program, I'm assuming you've had a check for anemia. People who come to my office have had a check for anemia, for high or low thyroid, for other nutritional deficiencies, and they don't have them. So I know that this is telogen effluvium. Now, if you haven't been in a formal weight loss program, you haven't had labs checked, and it's not going away after the 3 to 6 months, you don't see, your hairstylist doesn't see new hairs coming in, then you'll probably want to go see a doctor to have things checked, looking at the thyroid level, the nutritional deficiencies, looking for anemia, things like that. So I also assume that you're doing a proper keto kind of diet that's properly formulated. Good resources for that, of course, are the ADAPT program, the New Atkins for a New You, Keto Clarity, and other resources like that. Obesity medicine specialists trained at the Obesity Medicine Association are trained in understanding these conditions too. We're getting to the questions. Certainly, it's very alarming to have hair loss. So as Darlene says, yes, I would rather be fat than bald. Well, so I understand how important this is. So Sandra, you asked, your hair's thinned a lot on the top. You've been strict keto for 18 months. Is there any supplement that may help this? So if it's telogen effluvium, I would assume there would be some hair growth by now at 18 months. The thing is, there's no supplement that's been shown to help with telogen effluvium. You may want to see your own doctor for a check for the anemia, low thyroid, nutritional deficiencies like that, or a dermatologist to make sure that this really is telogen effluvium. Is there a particular element in the ketogenic diet that should be emphasized or reduced? No, I'm not aware of that. It's just the stressful event that's causing the hair loss. Susan says, yes, I'd like to know about this too. My hair has thinned out even more on the top. I can see it coming out on the comb. So again, Susan, it depends at what time point you're here on your journey. If it's early on, the first few months up until a year, hair is coming out, but it's you take a microscope or a magnifying glass and you see new hairs that are growing in, not to worry. Allison, yes, also said my hair has been falling out for the last 12 plus months, and I'm taking collagen, biotin, B complex, D3, iodine, a whole slew of other things that I'm not sure really help at all for the hair loss. And my searching, if it is telogen effluvium, then there's really nothing that can be done other than what's called tincture of time, meaning you just have to be patient. Lidia says, yes, I've been noticing a lot of thinning hair and it's getting downright scary. Yeah, I know. I've had that. I know how emotional this can be. I've been taking oils and all these other, again, I don't know that any of that's going to help, Lydia. I'm sorry about that. And then other people have said that taking biotin and silica and diatomaceous earth and all the, really not much evidence that I'm aware of that these things can be helpful as long as they're not harmful. I think that would be something to try, I suppose. And then Lindy asks, what about not enough protein? Well, again, I'm assuming that you're eating a properly formulated keto diet where you are getting adequate protein. In my clinic, we use a system where you eat to satiety, but most of your food is actually protein. And Shana asked, what about blood thinners and other? I'm not aware that blood thinners have any effect on the hair growth, but there are some medicines that do actually prolong or lengthen the time it takes for the hairs to regrow. So if you're on some medications, you might bring that up to your doctor or dermatologist as well, if the hair hasn't regrown by 6 to 12 months. And Mary said, I've read that some hair loss was normal and that hair would regrow. Yes, that's the general theme. It's not normal, but it's a response to stress. And you would expect that all of it will basically regrow. It's just a matter of time. This is Dr. Eric Westman with Ask Adapt, and please subscribe below so you don't miss out on any other episodes. Please give your comments, criticisms, appreciate it. Hope that's helpful.